Today, you and I are sitting down with the very first Balance Method ambassador. And he is going to give you the exact tools you need to walk into your clinic with more precision, more confidence, and better results. So grab a notebook, you're going to want to write this down. Let's go. Hi, welcome back. I'm really glad you're here today. Whether this is your first time joining me or you've been with me for a while, thank you for showing up. The fact that you're investing this time in becoming a better therapist, that already says something about who you are. Today, I'm sitting down with someone I have been wanting you to meet for a long time. His name is Kris Oosting, and he is the very first official Balance Method ambassador, which, trust me, is a big deal. Kris is a therapist, an author, and a teacher who spent years mastering this method. And he wrote a book about it because he saw something his colleagues were missing. And here's why this matters for you. If you've ever stood in front of a patient and you thought, I know what I'm doing, but I wish I had more certainty, more precision, more of that quiet confidence, this conversation is for you. Kris is going to give you the shortcut, the aha moments, the mistakes to avoid, and one tip you can use tomorrow morning. So without further delay, Kris Oosting, welcome to the show.
Nice to be here. Love it.
Great. So Kris, before we go into the questions, I want to start with something specific.
Yeah.
I want you to talk straight to the person watching this right now. Most of them are therapists. They've taken time out of their day to learn, especially from you. If they apply what you're about to share today, what could genuinely change for them and their patients?
Wow, that's a big question. Let's see. Well, when I say Balance Method Acupuncture, actually very simple, logical, and powerful. And let me explain that. I always do that with the word side effect of Balance Method Acupuncture. Does it have a side effect? Well, yeah, that's what I saw in the past 10 years teaching the method, is that people have amazing results, and amazing for themselves, but also for the patients. That, is this possible? What happened here? My pain is gone, you know? And then they get more satisfied patients because people start talking and you treat their family and whatever, yeah, and then they get a growing clinic. And I said, that's a side effect of Balance Method Acupuncture. And that's so cool, because even beginning acupuncturists running a successful clinic within months if they use Balance Method Acupuncture. And we see that our TCM colleagues struggle more. It's not about right, wrong, good or bad. That's not right. It's just a fact. And that's what I'm seeing. And that's what aligns with our mission as well. We say in the world, like, give people with chronic pain and discomfort back their quality of life in a safe, affordable and easy way. And Balance Method Acupuncture is really doing that. I mean, it's very safe. You're not needling at points that are dangerous. It's very affordable for the patient, I mean, and for the acupuncturist as well. And it's easy, and that people like it. Especially nowadays, people want results. They don't want to sit there and say, okay, I tried this for 10 times and maybe after 10 times needling something happens. And with Balance Method Acupuncture, especially with pain, as you guys know as well, is if you needle within seconds, the pain is gone. And people get kind of addicted to that idea, you know, because they have more pain and they will visit you and say, well, yeah, you helped me last time that fast. I mean, in 2 times or 3 times, and can you do it again? So yeah. In that way, it's simple, logical, and powerful. I always say Balance Method Acupuncture.
Wow, it's a wonderful side effect. I think many starting acupuncturists would want that.
Yeah.
So Kris, I want to take everyone back, because every great teacher has a moment, that one moment where the light bulb went on and they thought, I have to share this with the world. So take me to that moment. What was the ultimate aha experience with the Balance Method that made you say, I'm going to write a book about this, or I'm going to teach this?
Okay.
What happened?
Okay. A short intro. That's okay. Just a short intro to make the point. I did 12 years of TCM acupuncture, as we call it, and I was actually a little bit disappointed with the results I had at that moment. and wanted to quit. I'm an herbalist as well, trained in classic herbs, Shangalun and stuff like that. But the universe intervened to think, okay, you should not quit. And somehow I discovered Dr. Tan. It's interesting, but I'm not sure, especially because Dr. Tan's website was called Dr. Tan's Show at the time, and later I learned it was Dr. Tan's How, something completely different. But I was very skeptic. So he came to the Netherlands, and I went to his workshop, and okay, it was quite busy, a lot of people. Dr. Tan was, well, easy to talk with the others, like a little bit popular, I would say. But then he started explain from the classics, the I Ching and everything like that. And I thought, wait a second, this is different, because I expected that he said, if somebody has back pain, do this. If somebody has foot pain, do that. But he didn't. He explained a strategy. He explained logic. He explained reason. And he looked at it as an engineer, because he was. And I'm also an engineer in my background, so that resonated. So after, I think, around lunch the first day, I thought, I know. And there was a moment like, you could say the breakthrough or a shift that I said, okay, I take a vow. From off this moment, I will never ever do TCM acupuncture again. I will only do Balance Method Acupuncture, and I will see how I do it. Okay. Very interesting what happened then. After the course, I came back, and on Monday morning, a person phoned me with terrible pain in his feet. And can you help me? I can, because I just followed the workshop. But he said one thing, you cannot needle in my feet, because the other acupuncturist did it and it gave more pain. And I said, if you phoned me 5 days earlier, I could not help you, but now I can. 60 needles later, this man was crying in my clinic and say, you give me back my feet. That was
Wow.
the power. And that for me was the treatment I needed to validate my choice, so
Yes.
to speak. So from that moment, I think balance method only. And I thought, you know what? I bring Dr. Tan to Academy Chimbai. That's where I was teaching. But to certain reasons, he couldn't make it. And then sadly, Dr. Tan passed away. And I thought, you can't go, because it's too early. We still have to learn so much. And the thing I happened is we can't lose this knowledge. It's so important. We can help so many patients with it. And I thought, okay, I have to teach this in a way. So I tried to figure out a way how to do it. I didn't want to go in the same area as his disciples went, because that's not who I am. And I thought, okay, Confucius said, a teacher for a day is a father for life. He says, 以日为师，终身为父. That means that what you learn from a teacher in a day will serve you for the rest of your life. So I said, I have to have respect for this teacher. And that's the reason why for 10 years, I never had the word Balance Method Acupuncture in my course titles. That was out of respect for 10. Now I have. I think after 10 years, okay, I'm allowed to do it.
Yes.
I proved to the teacher that probably I can do it. And so, and during these courses, participants ask for more. Kris, we love what you share, but do you? And I thought I have to write a book. So I wrote a book in 2020, the first one, which was in memory of Dr. Tan and dedicated to his disciples. Then number 2 followed in 21. Years of silence. I was studying more, researching more, discovering more. And I wrote the 3rd book, which is now sold in 38 countries, about
Wow.
Dr. Tan. And it's not only the method, but I also want to give something to the community. As Dr. Tan always said, he said in his book, The Strategy of 12 Magical Points, my dream is that more acupuncturists become inspired and add something effective to this method. And I love it, because that means that he is not owning his method. He says, please give it to the world and use it as a basis and add something. And I had to smile, because during my book presentation of the first book, I was calculating, if you followed all my courses, how many slides did you see? Well, it was 3,800. Okay. How many pages of handouts did you receive? 1,500. So I thought, okay, this is quite a lot. So I have to structure that in a way. So hence the books, so to speak. And I'm writing my 4th book, the next book, which is on functional tools, because Balance Method Acupuncture is well known for his pain treatments,
Yes.
but it's very powerful for its functional treatments as well. It has meridian conversion. It has seasonal balance to resonate with the chi of the universe. It has wuxing, different than the TCM wuxing, but wuxing. The 12 magical points and what have you. And these are very powerful. And I mean, it's not like 10 times and maybe something happened. After the first treatment, something happens. But it's a different way of thinking, so to speak. So yeah, a lot of things happens, actually, what I was telling, but all this in sequence made that I thought I have to share this with the world. And it's only me. I always want to add something because then I did something for the teacher. You know, it sounds a bit worth, but I'm a worthy student, so to speak, because I added something to the method that was also effective. And yeah, well, that was actually, well, in a big way, my reason of doing this.
All right, great. So what
Yeah.
I take away from that is that by you following a class with Dr. Tam, it
Yeah.
changed your clinic, but
Yeah.
it also changed you, and you changed a lot of other people's lives by sharing that wisdom.
Yes. Correct.
That's amazing. That's amazing.
Yeah.
Okay, so here's where I want to get really practical because
Okay.
I know therapists are listening
Yeah.
and they're thinking, well, I want to start with this, but I don't want to mess up.
Okay.
So, what is for you the most common mistake, the misconception that you see again and again when people first start working with the balance method?
Okay.
What's the thing where you think, if I could just whisper one warning in their ear before they begin, what would that be?
Oh, you make it difficult. One warning. Let me see. Well, the first thing I always say, Balance Method Acupuncture is a meridian-based acupuncture, not a point-based. So lists of action and indications are interesting, but not that interesting anymore. That's a big difference. People are often shocked. And that's because everything is an expression of a movement of chi of a certain quality. And you find that in the balance method, you know. And we as acupuncturists influence this chi with our tool, the needle. That's our tool as an
Oh,
acupuncturist.
yes.
That means as an acupuncturist, you have at least to do Qigong or Tai Chi because you have to know how to work with Qi in the first place. But the interesting bit is if you read Ling Shu 1 that says the Shen is on the tip of the needle and the E at the problem. And that's a very important secret, I tell you, which we use in balance method as well, because we're not needling at the site of the pain. Very distal, very often. Sometimes, for example, if you have shoulder pain, you needle at the ankle. Well, that's far away.
Yes.
But the Shen on the tip of the needle means you know exactly where you place the needle, but you already focus your energy on the spot to move the chi. And then you see very quick results because this is possible. Simple, it's meridian based. We know the meridian network. You could say we are network managers, so to speak, of the meridian network. We know exactly how the network is running and where it is and how to influence it with our tool, the needle. Well, the second thing is we are clinging too much to Tsang Fu pattern differentiation a little bit, I think. That's for herbalists. I know many people are using it, but you have to do a small translation to get it into Balance Method Acupuncture. But if you know this difference and accept it, then it's very powerful. But I see that they are sometimes too stuck in it and they find it difficult. Yeah, but what structure do I use? With Balance Method Acupuncture, we always talk about global balance structures.
Mhm.
And the global balance structure has always four meridians. For example, Tai Yin Yang Ming is spleen, stomach, lung, and large intestine. Hence, Tai Yin Yang Ming. And these structures have already what Dr. Tan says, a dynamic balance. There's a yin-yang polarity change within the meridians. They're also connected in a certain way, internal, external, same name or whatever. So these structures themselves, you could say, are already charged with some energy, some chi, so to speak. But how do we use this concept of this global balance structure in a person? Well, to needle the right meridians at the right place. And this is a good example of how you use yin-yang in a clinical setting. Because everybody says, what are you doing? Well, I'm balancing yin-yang of my patient. Yes, but why are you not using a yin-yang balanced treatment approach then? And with the global balance structure, this is exactly what you do. That's why the results are like, what? Can this happen so fast? Yes, it can. And it's all described in the classic. It's not like big thumb, try this. It's all described. Okay, third time. Okay, I have the third, three. And then I quit. Yeah, three is enough. Okay.
Go ahead.
Three, what I see as a fear or afraid is that the number of needles we use in the treatment of pain. In Balance Method Acupuncture, we use more needles because if the pain is an area, we needle an area. If the pain is a spot, you needle a spot. If the pain is a line, you needle a line. We call this anatomic structure similarity. We have names for that in Balance Method Acupuncture. And so some acupuncturists say, oh, but 10 needles, that's a lot. But the point is, many acupuncturists are afraid themselves of the needle, not the patients. Because we have patients that had maybe 60 needles and the patient said, I'm okay, do more because my pain is gone. You understand? So
Yes.
they feel happy, but acupuncturists have sometimes this limitation. So then I say, not to worry. Look at your patient, how they feel. Yeah, but what if the patient is deficient then? We learned if the patient is deficient, you cannot use too many needles, especially stomach 36 or kidney 1 or whatever you have. Well, that's in your mind as well. Because what is deficient? If I tell you that, for example, Dr. Wang from the meridian, he's using the meridian palpation, that Dr. Wang, he used the 4 gates. There's liver tree and Geku, laatste test in 4, Chinese name sometimes easier. And to reset a patient who was treated wrongly multiple times. So they were exhausted, that she was exhausted. And he used the 4 gates to reset them. And most acupuncturists said, this is not possible to reset them. And he did it and it worked perfectly. So what's deficient? You know, sometimes we think too much deficient than the patient. Always, I mean, of course, look at your patient when it's not like bang, 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 all the needles. That's not what Balance Method acupuncturists do.
No.
They place a few needles and they ask, where's the pain now? Put a few needles, where's the pain now? Always interaction, because that's why I sometimes see as well that acupuncturists who start with it say, yeah, but you're talking so much with the patient. Yeah,
Yeah.
it's not an intake. No, we're discussing what's happening during treatment. You know, because we want to know what's happening during treatment. That's the only feedback we have. It's not like we stick in needles and next week we ask, how did it go? Because how do I know it was the right treatment? You
You
understand?
ask the patient.
Yeah, ask the patient. So especially in case of pain then, you want feedback. Because if the patient said it's okay or it's 80%, we say this is enough needles. It's not that we plug in many needles. No, we have constant feed. If 3 does the job, 3 does it. If 30 does it, 30 does it. Because you want satisfied, you want to have healthy patients. You want to give them back the quality of their lives. That's what you want.
Yes.
I mean, down to earth, a patient is not interested in acupuncture. It's interested, can you take away my neck pain?
Yeah.
And if you ask one step further, then it says, yeah, because my neck pain stops me from driving my car safely, but it's also stopping me from doing sports, and I'm getting so irritated that I'm angry with my children. So if you see these steps, yeah, and that most people miss that. So that's one with Balance Method. You take away the pain, they perform differently in the things they want to do, so they become a nicer person. That's giving back the quality of their lives.
Yes.
You see, so to summarize, it's meridian-based. That's important to know. It's not very hooked up to Tsang Fu patterns, and it still works amazingly. And don't be afraid of using needles.
And talk to your patient.
And talk to your patient.
Yes.
Thank you. Yeah,
Perfect.
talk to your patients. Yeah,
Wow. Those are wonderful advices. I think you just saved us months of frustration.
I hope so. Yeah,
So, Kris,
yeah.
this is the part I'm most excited about
Okay.
because everyone watching
Yeah,
has a clinic. They
yeah.
have patients walking in maybe even tomorrow morning.
Okay.
And I want you to give them like one thing,
Oh, shoot.
one golden tip, one favorite strategy, a short case, maybe from
Okay.
your book, or something that they can apply literally tomorrow.
Okay.
And please don't hold back. Give us the good stuff.
Okay. Yeah, but it's only one thing. So, okay. If I have to pick one thing, it's difficult. I think I would go for my chest protocol. What's that? That's for patients with lung problems, chest problems, for example. I mean, during the 2020s, when everybody had breathing problems and whatever you have, I was treating many patients, but also many patients that work on ambulances.
Oh, yeah.
They got infected and they have breathing problems, like
Yes.
whatever you have. And what I'm using for is what I call my perfect global balance structure number 4. That is a 2 global balance structures together, but there are always 6 meridians. I created 24 of them because I needed different structures to treat more complex problems. And
Okay.
this one is kidney, pericard, yang ming, and tai yin, yang ming mixed together.
All
That
right.
means you needle kidney, pericard, large intestine, stomach, a spleen, and lung.
Okay.
And we use projection. It's not function. It's like, okay, if this is the throat and your elbow is your navel, then this is the area about where you needle, so to speak. Yeah.
Okay.
And we use the 3 weights of Master Dung. That's on the same level as gallbladder 39, 37, and 36, but in between stomach and gallbladder meridian.
Okay.
Yeah. So up till now, after all those years, I've got still 100% success. That means
Wow.
put in the needles, they can breathe deeper. How do we know? You put them on the table, breathe in, breathe out 3 times. You listen, how do they breathe and how does it move? That's important. Your baseline measurement. Yeah, okay. Then you place the needles. Yeah, you place the needles. You say to them, breathe in and out 3 times again. Listen and watch. And then you ask them, where does it feel still stuck? Why do you listen? Because if there is more space to breathe, it sounds lower.
Ah.
And if they breathe first like, and then they go, it's longer. That's how you hear, because you have to check.
Yes.
So what did we do? For example, if I would hold the lungs in my hands, I don't have I have a cup here. Yeah, sorry. I put the lungs in this cup. Yeah, I say
Yes.
breathe. People say, I can't breathe. The cup is too small. Yes, okay. Then I take a bucket. I don't have one here, but imagine a bucket. I have
Okay.
the same lungs, put it in the bucket. Now breathe. Of course I can breathe more because it's bigger. I say,
Uh-huh.
that's what I just did.
Wow.
Because everybody thinks, are you treating the lungs? No, I'm treating the environment. Because if the lungs are irritated and happens through viruses or whatever you have, I mean, can also be asthma, bronchitis, COPD, everything like that, then all these little muscles in between the ribs are tightened
Uh-huh.
all around, all around. So it's like this. So you can do your thingy to open your lungs, but if the environment is not bigger, it will help a little bit and then
Yeah.
not. So with the treatment, we relax all the muscles and give the lungs space to open.
Oh,
So
yes.
that means that all the stuff in between can be released. So most of the time after treatment, they say, oh, dearie me, it didn't work because I had to cough much and you don't know how much came out. They think it was generated. No, no, no. It was already there. Thank God it came out because that's what the lungs
Yes.
want to do.
That's a good thing.
And that's, well, yeah, that's my amazing protocol. Every time I'm like, yeah, okay, not to worry. I put the needles, I can walk away like a basketball player, famous basketball. I know it's in. I know it works. That's
Wow.
a protocol I want to share. But there is one meridian which I like very much, and that's Yang Ming large intestine. Why is that? Yang Ming large intestine is balancing the chest, but also the lower abdomen. And we call this image and reverse image. Yeah, we have
Yes.
a title for it. So you always have 2 for the price of 1 in Balance Method Acupuncture. And
Great.
sometimes you even have 3 or 4 for the price of 1. 1 needle, 4 spots, it's treated. So
Woohoo.
simple. And Yang Ming's stomach is so interesting. Yang Ming large intestine, because he says, yeah, but what with the large intestine? No, it's what does it balance? In Balance Method Acupuncture, it's a network. And Yang Ming large intestine balances both kidneys on the stomach, on the abdomen, yeah,
Yes.
both livers and the stomach. But if you look like on the lower abdomen, what's running there, it's the renmai, but the liver goes over the renmai in the middle and then splits out, and the kidneys are next to it, and then there is one stomach meridian. So you take a big area of the lower abdomen. So
Yes.
large intestine Yang Ming we use for treating gynecological problems as well, but we also use it as a focus meridian. For example, You're using, there is a kind of liver stagnation thingy going on or whatever in the lower abdomen, and it gives menstruational problems. Then we use a functional treatment called Jue Yin Xiao Yang. That's liver, gallbladder, pericardium, sanjiao. Yeah, we use that with 2 needles, the shu and the he points we needle. And that's a functional treatment. But we say, yeah, it's very functional. And the body says, I'm cool. But what do we use as focus meridian? We needle, for example, large intestine, say 5 till 7 line, because this is focusing to the lower abdomen and more or less says to this functional treatment, in Xiaoyang meridian conversion, there is where the problem is. And Yangming large intestine is great for that. So that's probably my favorite meridian, if you ask. I use it often to treat the problem, but also to point at where it is. For example, if you use large intestine 11, we know it focuses at the eyes because it's Yangming stomach, yeah?
Yes.
So that means in hay fever problems, we have it, but you can also focus on other structure to the eyes or to the area around the navel or whatever. So these are actually my 2 things to be.
Great.
I'm using the Steve Jobs. One more thing. Well, that Yang Ming, you know, you got one more thing. So the chest protocol, which is kidney, pericard, Yang Ming, Tai Yin, Yang Ming, image projection, and the 3 ways of Master Tung. And that Yang Ming large intestine is very cool for treatment, but also for pointing at the area. Especially it's regulating Shaoyin kidney and Jiayin liver. Very important. Also for gynecological problems, but digestive problems, what you have, Crohn's disease and stuff like that.
Wow, that's great. Thank you for sharing that. I think you saved people a lot of time who will have the patient who comes in with the same problem next week in their clinic. I must say, you sounded a bit Darth Vader there when you were breathing.
Okay, yeah, that's possible. I am your father. Yeah, something like that.
Exactly.
Yeah.
So, a last big question.
Yeah.
And I think this might be the most important one.
Okay.
Because tools, they are tools, but mindset is everything.
Yeah.
What is your most important piece of advice for therapists who want to treat with more precision and more confidence? What does it take in here to actually become that kind of practitioner?
That's a completely different question. Interesting.
You take
I
your
would,
time. It's a difficult question.
yeah, but I like the question because it's not asked very often. Most questions go about techniques and tools and stuff. How can I treat my patient better? Actually, if you look at practitioners, most courses they follow is for helping other people, not themselves. Very interesting, is it?
Yes,
We should
yes.
follow more trainings that help ourselves as well. And
Yes.
mindset, what I see, especially in beginning acupuncturists, if they do balance method or not, it doesn't matter, is that they are not so confident. Somehow they don't trust themselves. And you can say, trust yourself. Well, that's not always working. But what can help is maybe to have a curious mindset. Be curious. Because when you're curious, your mind opens to new experiences. And because we're always afraid of failure. Oh, you
Yes.
did it wrong. You know, the patient, so far, never a patient died.
Oh no.
And you move chi anyway, so it won't go wrong. The body will adjust. But we are so afraid of failure and doing it wrong. That's our society bit as well. But your mind has to say, wait a second, I can't do it wrong. I can only learn and grow. Because
Yes.
if I did that, then I know what doesn't work. Is it?
Right.
Yeah, that's what
Yes.
it is.
Yes.
So I'm so curious how this treatment will work out. I was so curious to see what this combination will do with this patient. What can I learn? What I learned, for example, I had at the beginning the same problems. Not to worry. I was sometimes like sweaty hands and everything. Oh
We
dear,
all do.
what if I do it wrong? And what if
Yeah.
what if the pain is not gone? You know, because on the website it said pain gone, and you don't do it.
Yes.
In the beginning, you think you're wrong, and later you think, okay, breathe in, breathe out. Be curious. It didn't do anything. Why? Can you tell me where is the pain exactly? I asked the patient again, and the patient said, well, here. And I think, oh, bugger, I balanced the wrong meridian. So I go to my steps, I used to do the right one, and the pain is gone. But if I didn't if I was not curious, but in failure mode, like I failed, I not do anything, you didn't help the patient. But if you're curious, your mind opens and say, this is interesting. You know, 很有意思, and Chinese said that, very interesting, very interesting. And what happened? And if you stay this, okay, balanced method acupuncture, one thing, it's logical, I can reason it. Never forget that. It's logical, I can reason it, even if I did it wrong. So you do reverse engineering. Okay, what happened? And often it is or the wrong location or the wrong meridian. So there is no failure, there's only growth. And please, 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 what I say to, don't go for the next silver bullet, the shiny thing, because it often happens that people use balance method and it didn't give the results they really wanted. Yeah. And it, balance method don't work. I try another one, the next silver bullet. But if you ask yourself, what did I learn here? Interesting. Interesting. I wonder what happened. You know,
Yeah.
and if you analyze it, I see it already. And then you grow. And then there is no need to go, because I use 100% balance method acupuncture, functional and pain and whatever you have. And I can so far solve every problem. There was no need for a silver bullet, another one. I also chased silver bullets. I have to admit, I did. Yes. And I want signatures of famous teachers as well. Yes, I know I did. But if you have a system you can reason with and it has logical steps, then there is no need to do it. So, and another thing I really want to give, and it's not the most favorite object, I know, is read classic texts, but try to find, for example, Paul Unschuld is a very good author because he also translated the commentaries.
Okay.
Like, why did they explain that? And what you do then is you create, how do we call it? Your mind actually needs a vertical ground, so to speak, where these new techniques can take root in. So you say, yeah, but I know a lot. Yeah, but if you read the classics with an open mind, with curiosity, that's the difference. Not like, I have to remember this. No, that's not the case. We don't give you a test at the end. But just like, I read a page today, and in 2 days I read another page. And if you read it from curiosity, you'll be surprised what your mind picks up. Because your mind is always busy with the patient you didn't solve. It is, subconsciously. Don't worry, it does. That's a good thing, because many of you have the experience that when you were in a course and the teacher said something, that's my patient. That means your mind was working on the patient in the background.
Yes.
Yeah, background process. So if you read these classics and challenges you have, call them challenges or growth moments. Don't call them problems. I mean, that doesn't work. It's limiting. So the mindset you have there, curiosity grow, and then you read it again, and then you discover things. For example, I was treating a patient with a CVA, and his speech was not very good. And a pucker, and I was do at that time projection and his tongue and it didn't do. And I think, okay, I have to go back to the roots. So I take the Ling Shu, and this time I go it around, and suddenly I read a statement that says, the liver controls speech. I think, I read that before many years ago, but I didn't remember that. So then I used Jie Yin Xiaoyan as a structure. And the logopedist, or how do you call it? It's the
Speech therapist?
Thank you, speech
Yeah.
therapist, that's the word. She suddenly said that his speech suddenly changed so rapidly. And it was from the moment of treatment. So I think the classics are not that bad. But I went in with the curious mind, not like, what did I do wrong? What can I discover? It's a treasure hunt. You know, so that's what I want to give. Please have a curious mindset and don't think in failure. Think in growth, think in learning. Because in the end, you want to be you want to be an awesome, amazing therapist, or great, or whatever title you want to give to it, but you want to be the therapist that can solve the patient's problems. Don't be afraid of a patient who gives you a challenge and you think, I have the disease of, and it gives you a very difficult name. And I think, oh, that's not in the book of Machocha.
Oh dear.
Dear me, what do I do now? And I say, okay, breathe in, breathe out, become curious. And then you say, that's very interesting. How does that manifest in you?
Wow.
And
Yes.
then the patient thinks, oh, somebody wants to listen to me. And the patient tells you, well, the disease of such and such is normally this, but in my case, I have such and such and such and such and such. And then you think, I already know. It is part of this pattern, part of that pattern, and you can solve it. Because if you have on the telephone, yeah, I have the disease of difficult name, and can you help me? And think, never heard of it. I probably can't, you know?
Yeah.
And no, you think, oh, that's very interesting. How does that manifest in your case? And the patient, here somebody's, and they tell you everything. And then your mind starts to use all your knowledge and say, okay, breathe in, breathe out. I'm confident because what the patient is telling now, I know it's basic stuff. See, so I think, yeah, now I'm saying that's probably the most important takeaway to say. Yeah,
Yeah, that's some great advice. I always think we fail and we learn.
yeah.
That's very important. Yes, thank you for
Learning,
that.
learning and growing, learning and growing.
Yes, yes, yes. And an open mind.
Yes,
Yes,
please. Yeah.
yeah.
Hmm.
Kris, this has been such a rich conversation.
Thank you.
I know everyone watching has probably filled a page of notes by now,
I
wanting to
hope
use
so.
it in their clinic.
Yeah.
So before we close, I
Yeah.
would like to ask you one last thing.
Okay.
So, if you could leave every therapist watching with one final message, the thing you want most them to walk away with, what would that be?
You go with that one again. Okay. One more thing then. Huh? One more thing. Let me see how I can tell a lot in one more thing.
Maybe very short,
Yeah,
like
I
a
will.
mantra or
Okay,
something.
okay. A mantra. Okay. Um, change your mission to that you want to give people with chronic pain in this concept back their quality of life in a safe, affordable, and easy way. And balance method is the way. It
Wow.
rhymes.
Great. That's
Okay.
great. That's very
I,
powerful.
may I end with a quote of Steve Jobs just to end with it?
Yes.
The only way you do great things is to love what you do.
Wow. Yes. That's
And
an
as a balance method acupuncturist, you know as well, we
yes.
love what we do.
Yes, we do. We do. We do. So genuinely, thank you so much for the work you do,
Oh,
for the
welcome for
book,
interviewing me.
for the wisdom you share, for being so generous with everything. This profession, the Balance Method community, we are all very lucky to have you, really.
Oh, thank you so much. Thank you so much. Get a little bit blushy.
Great. Thank you so much, Kris.
Thank you.
Okay.
Bye bye.
Bye. All right. To you, watching right now, do me one favor. Take one thing from this conversation and use it this week. Not next month, this week. That's how change actually happens. One small move at a time. And before you go, I see how hard you are working to get better at this craft. Keep going. Your patients are lucky to have a therapist who cares enough to keep learning. See you next time.